Good afternoon, everyone, and welcome to the Bipartisan Policy Center. I'm Tim Shaw, Associate Director of Economic Policy at BPC and the Policy Lead for BPC's Paid Family Leave Task Force. Thank you all for joining us today as we meet to discuss a critical issue facing millions of Americans, the financial strain faced by the sandwich generation, those caregiving both for a child and another adult loved one. BPC has worked on issues of caregiving for a long time, and the research is clear. Family caregivers are a critical part of our nation's social fabric. According to studies by AARP, every year, around 40 million family caregivers in America provide a collective 37 billion hours of caregiving to loved ones. These numbers show that as the number of our loved ones in need of care have grown, family caregivers have risen to the challenge. We also know that providing care comes with a cost. Caregivers report significant challenges with loneliness, physical and mental health, and, the subject of today's event, financial challenges. 78% of caregivers pay out-of-pocket expenses for caregiving, representing a significant portion of their income. We will dig into more, but we know about these financial challenges, including a new BPC survey on the topic later in the event. However, it's important to say that caregiving should not just be seen through the lens of burden. It is our loved ones that we are talking about, and caregivers report that they consider their role as caregivers a critical, meaningful part of their lives and identities. Many of us who work in this area know this personally through our own caregiving stories. My parents, for instance, were early members of the sandwich generation. I distinctly remember being a teenager, helping move my grandmother from her hometown in Ohio to our home outside Chicago after she had taken a fall and could no longer care for herself. It was not easy to meld our lives with hers when she moved in with us. I know it was hard on my parents. It was difficult on their finances, it was sometimes incredibly stressful, and it was frankly hard to deal with me and my two brothers, as we required their love and attention and didn't always fully grasp what they were going through. It was also beautiful, though. Because of those challenges, we were able to spend wonderful moments together as family, moments I wouldn't trade for anything. My family, however, was lucky in many ways. We had a space that could easily accommodate her. As a pastor, my father was able to set his own schedule and more easily make time to be with her. Most people don't have that luxury, and that's why we're here holding this event today, to highlight the policy tools ranging from paid family leave to long-term services and supports that we have available to help family caregivers as they do the important work of care in this country. Our keynote speaker today knows both the policy and personal side of this issue better than most people in this room. Senator Chris Dodd, who I'm sure needs no introduction, holds a long list of accomplishments from his 30 years as the senator from Connecticut, ranging from financial reform to improvements to our voting systems to health care. Most relevant to our purposes today, he was the champion of the Family Medical Leave Act, the foundational bill for family leave in this country. In addition to being a legislative champion for children and families over the course of his career, he is also a caregiver himself, and so knows these issues intimately from both the policy and personal side. Over the course of working with us over the past year, he has helped us more deeply understand the human side of the policies that we are constantly debating in Washington. We are honored to have him as a member of our Paid Family Leave Task Force and to have him here as our keynote. Senator?
Thank you, Tim, very much. Those are very generous comments, and I thank you for inviting me to be a part of the effort here on the Bipartisan Policy Center's efforts to develop some consensus, if we can, around the issue. And the only danger I have here, although it's been 10 years since I left the Senate, I care so much about this subject, I won't filibuster. That's the danger. We've eliminated that as a policy or as a tactic in the Senate now, apparently, with them along the way. So it's a great honor and a pleasure to be a part of that and to be here today. And I'd be remiss if I didn't tell you what a wonderful opportunity you and the audience will have to hear the panel. We talk about the subject matter and bring an extraordinary amount of background and information on the subject matter. And just going over their resumes and backgrounds, and several I've dealt with over the years, really have given a great deal of thought to this very complex issue. The challenges, obviously, as Tim pointed out, the legitimate needs that people feel for their family and loved ones, and the financial burdens borne across the spectrum of not only the employee or the caregiver, but also the employer and others that have to deal with these issues. I must tell you that just going back and thinking about the issue, I'm often asked in these days, having been out of the Congress now for many years, what were the issues that I cared the most about, or that I thought were the most important? And invariably people probably say financial reform, because I'm doomed to have Barney Frank and I on that bill saying for eons to come. But I don't have to think hard about the answer to the question. And this is not something I've said exclusively here in this room. In fact, in a financial services forum, I got asked the same question. This subject matter involving families and children were the issues that I got the greatest satisfaction of working on, meant the most to me, more than anything else. Bill Bradley and Pat Moynihan and Bob Dole and I started the Children's Caucus back in the early 1980s. There was no caucus for children. We had one for every imaginable constituency you can think of, except for 1/4 of the American population who were under the age of 18. So we worked together across party lines to keep an eye on food issues and education issues and health care and the like. So to be involved in today in talking about the next generation 26 years later, from when we passed the Family Medical Leave Act, is really a great pleasure, personally. Again, I take great pride in some of the other things we did, but no other set of issues gave me as much satisfaction, not only on this subject matter, but dealing with autism and premature births and after screening and a long list of issues involving children health care that you mentioned already, Tim. So I thank you for that. And again, I thank the panel who you're going to hear from to be involved. It's already been mentioned, I presume many of you know this, that we're trying to see if we can express some ideas on how you might get this paid leave bill done. Typically, in many ways, the states are running way ahead of the federal government on the subject matter. Someone will correct me. I think it's 7 states, I think, today that have actually adopted legislation. But I think almost half the states, or maybe more than half, have actually considered family a paid leave status and various formulations of that on who pays and so forth for the program. But there's my hope that we'll get to that point. I'm working with Rick Santorum. Rick and I didn't see eye to eye on much in our careers in the Senate, but we wrote together legislation on autism. We wrote legislation together on dealing with Lyme disease. Again, maybe not overwhelming issues in the minds of people, but proving once again that there were issues in which both Democrats and Republicans could come together on. And Rick has been involved with us here, along with Maria Contreras-Sweet, the former administrator of the Small Business Administration, bringing a healthy perspective of employers and what their concerns, particularly small employers, where a majority of women still work. For those mom and pop operators, that's where the jobs are, and have been, at least over the years. A lot of that is changing, but nonetheless is a important constituency. So we're trying to go ahead. I always want people to know I'm a big supporter of the Family Act, and this won't shock anybody. First of all, on a personal basis, Rosa DeLauro Greenberg, who's the author of that bill, was my chief of staff for 7 years, my campaign manager through 2 Senate elections, and Rosa and I talk almost daily about life and other matters. And Rosa knows about this issue. Her mother, Louisa, who was the alderperson for 45 years, representing Worcester Square in New Haven as an alderperson, lived to be 103. And Rosa and Stan took care of Louisa for many, many years as her health deteriorated, but the longevity persisted. Not an uncommon feature today, and we're going to see more and more people living a lot longer, being a lot more productive, but placing additional burdens on the sandwich generation, if you will. So we're going to try and work out some ideas that we can maybe find a middle ground on some of these issues, but I wouldn't want anyone to leave the room and think I didn't have an opinion about the various proposals that are out there. And my hope is that things will move forward. Let me just also tell you, and again, just a little bit of history you might enjoy. Last year, I forget, not everyone knows all of this. It was actually in February of 1993 that the bill was signed into law by President Bill Clinton. It had been through, as I think some of the notice here pointed out, I went through 7 years, 2 administrations, 2 vetoes of the legislation to get the bill done. And with the election of Bill Clinton in 1992, literally 20 days, less than 20 days after he was inaugurated, we passed both houses of Congress, the Family and Medical Leave Act, and he signed it into law. And I remember he turned to me in the Rose Garden signing the bill into law. I said, this governing is easy. This isn't bad at all. I'm in office for 15 days, and I got a major bill done here on the thing. And he learned painfully, that happened. A lot of work went into that before he came along. But I called him last February on the 25th anniversary of the bill, out of the blue. Was sitting there actually watching the Super Bowl. It's always dangerous to call Bill Clinton. It's not a short conversation. And I thought, well, I've got 10 minutes before the game starts, and I'll say hello. Well, almost at halftime, he was still talking about everything else in his mind that day. But he said to me something very interesting. He said, of all the issues, no matter where I go today in the United States, of all the issues I was involved in, more people come up to me and thank me for the Family and Medical Leave Act than anything else I did in 8 years. It's interesting that people remember that particular law and what it meant. It was used some 200 million times over the last 26 years by people. But I kept a lot of the language in it that we had in the fall of 1992, and as we came into 93, I could have changed a lot of that and probably passed it. But I had made a commitment to a number of my Republican colleagues. This will really shock you. I had 13 Republican co-sponsors of the Family and Medical Leave Act coming out, who voted to override President Bush's vetoes on the bill. Hard to imagine, sounds quaint by today's standards, with that kind of cooperation. And so I'll always be grateful to people like Arlen Specter, who is terrific. I don't want to get him in trouble any more than he may be in today, but Dan Coates was a principal co-sponsor of the legislation, along with Al D'Amato and Jim Jeffords, John Chafee. I'm going to forget some people along the way here, but there was a pretty good list of Republicans. George? Domenici was also a sponsor. Thank you. I hope Pete and Nancy. Don't do this to me, I tell you. I'm going to have those moments, we age on the process. So I wanted you to know the history of that as well, and the cooperation we had and people understanding it and what a difference it made. Even the Bush administration, and I've not really told this story to too many places, but I'll share it with you because you might appreciate the historical significance. Jim Baker was Secretary of State for George Bush and loved the job. But in August of 1992, the Bush campaign was not going terribly well, despite the fact he had high favorability ratings. So much to his displeasure, they dragged him back into the White House to work on the campaign in August of 1992. And I got a call because John Sununu had been the chief of staff, and every time I'd go to see John about whether or not they'd sign the bill, he'd give me a big smile and say, not in my lifetime, but we're going to sign this bill. Jim Baker calls me. He says his opening line was, "Can you tell me why we're against this bill?" I said, weird sense of humor. And I said, I've been trying to do that for 7 years, or almost 7 years. So he said to me, look, give me a couple of days to go over and look at this thing. And he called me back and he said, look, if we come out for it, the people who are against it will be terribly upset, and the people who are for it won't really believe. Why weren't we for it earlier? But he said, if things turn out to our benefit on election night, let's get it as soon as we can after the election. So God will never know what would have happened, but I can tell you, at least Jim Baker indicated to me that had he been chief of staff, we might have had more cooperation on the bill than we did earlier. Let me just share again. I presume I'm preaching to the choir on all of these things, but some of the statistics that are important to remember. And again, Tim touched on some of them here, and this whole issue of family leave, which is so important. I mean, obviously, I don't think there's much debate today about paternity leave, paid leave. People I finally get that and so forth. It would have been a hard sell for me 26 years ago, but today I think people have come to recognize that newborns, you ought to give those weeks and time off for families to absorb the novelty of the new child or new children in their family. So I'm not terribly shocked at that. It's the family leave piece that for some reason people have a hard time getting their arms around. In many ways, it's the easiest one to explain. Go up and spend some time at the Children's Hospital. One of my daughters, I have 2 young daughters, was up in an outpatient service. It was standing room only that day. And almost every person in there, mostly women, a few men, but mostly women, I presume were mostly working, taking the day off or getting away to try and take care of a child that needed attention. Just one visit to the Children's Hospital a few blocks from the Capitol, I think, could alter almost anyone's opinion about the importance of giving families the opportunity to be together. Maggie Hassan is a great friend of mine and a real advocate of a paid leave proposals. But she talks about it personally as well. I was with her the other day. Adrian and I were up there in the office, you were, Tim, and she talked about her son, Ben, who's been in serious physical shape since the day he was born. He's now 30, but a very rough life he's had, and easily would have qualified for institutional living. But as Maggie said, Senator Hassan said, no one's going to know how Ben is feeling or reacting. I nearly had to look at him, and I can tell where things are working and where things aren't. And that connection, despite the good care and wonderful people who are involved in the subject matter, there's nothing like a family member, nothing like a parent that can be there and see all of those things in the conversation that doesn't exist verbally, but is transmitting every single second in that relationship. One of the reasons I passed family and medical leave was I voted against C. Everett Koop to be the Surgeon General of the United States under Ronald Reagan. He had very different views than I did in those days on women's right to choose on the subject matter. But I did not know he was been a pediatric surgeon. And so I called him and told him about my bill. And I asked him if he'd be interested in coming to testify. He came in and blew the doors off the place by talking about, as a surgeon, what it meant to be able to have family members around during a child's severe illness or surgery. They're getting rid of the white coats, getting rid of the professional care. Just the rate of recovery alone, statistically, if you're just interested in dollars and cents, the idea of getting a child out of an institutional setting where caregiving is going on, bring a parent, a child, a sibling around, and watch that child's recovery just increase dramatically. Here was a very conservative Surgeon General of the United States and a great advocate 26 years ago of the legislation we were moving forward. So if you get the people around to understand this, whether it's Maggie Hassan and her child, or a person like C. Everett Koop, you begin to listen to professionals talk about what a difference it makes. And just again, to repeat some of the statistics, and I know there'll be others talking about them, and the numbers I've been given, 8 in 10 young people spend their own money on caregiving at all, very little. There are industries and corporations that are wonderful in providing paid leave, but that's not the standard across the country. Those are the exceptions, if you will. 19% switched from full-time work to part-time work. Imagine that, 1 in 5, literally dropping the full-time job to provide that time to be with a loved one. 25% have reduced their retirement savings in order to provide the resources necessary to take care of a loved one. Some 25% took leave without pay to provide care for another family member. So the family leave piece is really a major piece of this conversation. And 20% of that 25% are dealing with spouses and children along the way. So you get some sense of the magnitude of the issue. Now, I notice this is called the sandwich generation, and a younger generation with children taking parents. I must be a very old sandwich, I hear say, because it's no secret. I'm 75, and I have a 14-year-old and a 17-year-old. So I'm no longer, I'm not part of that millennial generation at all. But I'm in a situation, and again, I don't, there's so many people in it. It's kind of the examples, I'm sure, in this room. People can share stories. My parents died when they were very young. They died in their early 60s, many, many years ago. So I watched friends of mine and others go through that situation with parents and children and how to balance that. What I've run into is siblings. I'm one of 6 children. I'm the 5th in line, but I am now the principal primary caregiver for my siblings who are in their 80s. One of my brothers, we talked about this earlier, has Alzheimer's. And as his doctors have told me over and over again, if you've seen one Alzheimer's patient, you've seen one Alzheimer's patient. Every case of that manifests itself differently, and it can go on for years. But in my brother's case, he needs 24/7, no exceptions. Literally, someone has to be with him every minute of the day. The fear of falling, how he cleans himself, how he eats, and everything else. And now, today, unless you have long-term care insurance or can afford it and can pay for that, it's a staggering cost to pay for 24/7 care. Roughly running, depending where you live, somewhere around $18 to $20 an hour for just caregivers, not necessarily professionally trained caregivers, but just people who will be in a room, can feed someone, and can also change them and do other things along the way. You could do the math yourself at 24/7, what that involves. My wife, who's not a direct member of the family, and my siblings, has been incredible. The hours we spend, not just on worrying about how to pay for it, that's big enough, but what you don't realize is how difficult the paperwork, going through all of the various programs that may be out there and whether or not they qualify for any of it at all. I remember just almost every day we do it, I go, how do people who don't have this, or don't have people who can understand all of this, even begin to deal with all of this? So caregiving is not just being there, not just feeding someone, not just changing someone. It's also navigating this little encyclopedia of information if you're going to provide the kind of support they need when they're ill or needing care. So again, I want to pick up on something Tim said. I know this may sound strange to some of you who are not in the situation. I can't tell you how much I love doing this. I talk to my siblings more today. Every day, the four of us talk. One sister passed away a few years ago. But every day we talk. Even my brother with Alzheimer's, I'll call him, and I'll try and go back 30 and 40, 50 years in some cases, and talk about things that he may be able to react to along the way. But I'm spending more time with my siblings today than I ever did for many, many years. We talked, we saw each other holidays, but that's basically what it was, with our own lives and being busy. My own children, what it means for my young daughters to be able to see the kind of care and so forth that goes on, and how much they mean to my older siblings to be around them as well. So Tim, families do really, there's a benefit to this that's hard to explain to people who aren't going through it in many ways. And I know I said it may sound strange, but the joy of doing that is something I feel particularly strong about. And again, it is a burden. It's tremendous. It can put strains on siblings when you're dealing with all of these issues as well. Some think you're not doing enough. Some think you're doing too much. What are we making decisions? Go here, we go there. Who are we talking to? So in a way, it can drive you a little crazy on the thing. But again, I come back to the point that makes you feel better. I mentioned how the states are doing a lot in this already. And proud to say my state of Connecticut, the new governor in the state legislature adopted a paid family and medical leave bill a few weeks ago. Kind of unique and different. It's totally employee supported and payment, not a co-pay with employer side. Interesting, but that's an overwhelming Democratic legislature and a Democratic governor. It'll be administered by private carriers of insurance rather than the Department of Labor, which you'd assume would be the case in various places. But so each state has sort of different models to sort of suit their own needs and their own abilities to manage the issues, which I think is great. I think to encourage that kind of their local involvement on an issue, if you will, along the way makes a lot of sense. At any rate, I'm grateful to our panel. And Tullison, and I thank Ann for tremendous work she does already. Ben, and I've got to pronounce this again correctly, Ben Vetti. Vetti? Vetti, yes. Vetti, thank you, Ben, I appreciate that. Jason Resendez, and dealing with the Hispanic community and Alzheimer's, and I congratulate you for what you're doing. Tim, you're going to be up here as well, you mentioned earlier, and Catherine Hayes. Thank you for all your work you've done as well with Catholic Charities and various programs over the years. So we've got a very exciting group of people to talk about this. I'm going to hang around for a while, if you'll let me, to listen to what you have to say, and count me in. I mean, again, I'm determined to see something happen. I'm not sure it'll happen this Congress. Again, given the pace, but things. I was with a couple of my colleagues yesterday. Pat Leahy celebrated yesterday, cast his 16,000th vote in the United States Senate, beginning in 1972. And Chris Murphy, I was chatting with, and Chris Murphy said, given the pace we're engaged in Capitol Hill, he said, if I stayed as long as Pat Leahy, I might cast 4,000 votes. Not a lot happening up there on some of these important issues. But I'm a firm believer, given some of the conversations we've had, members of the BPC have had with senators who might surprise you, willingness to talk and figure out maybe what to do, but they've got to get along. They got to move at their pace. You can't force feed people this kind of a thing. It's an education. It's getting constituents to talk about it, getting your colleagues, knowing your colleagues better. I can't tell you how much investigation I did about colleagues who I remember going to Jake Garn, who was a good friend, again, a Republican from Utah. Jake donated one of his kidneys to his daughter to keep her alive. He was out of the Senate for weeks on end, got paid. No one thought he was being derelict in his responsibilities as a senator. In fact, had he come back to work, he might have been in political trouble, with people wondering why he wouldn't take care of your family. Ted Kennedy would get eloquent and passionate about the subject matter when he spent weeks in the hospital with his son Ted, who had his leg amputated because of cancer. And again, no one took away his pay. No one said he wasn't doing his job. Again, I went down, I did my work with members who had taken time to be with their families. Because 26 years ago, remember, when I arrived in the Senate, there was not a single woman in the Senate. And a couple of years later, Barbara Mikulski came in. And I was dealing with a generation of World War II veterans who had come back after the war, and this so-called traditional lifestyle where women stayed home, men went to work. And so neighborhoods, and there was a caregiver around. What was I talking about? It had worked for them between 1947 and the thing, and trying to educate a generation of World War II veterans, wonderful people in many ways. What helped me was their daughters, because their daughters were having a different life experience than they were, and they were great at educating. So I did my work and examined among my colleagues who had daughters that were at least in their late teens who could talk about a work experience, and even if they weren't yet parents along the way. So it takes a lot of work to do that stuff. You're going to know your colleagues well, understand what they're going through. You can appeal to people on something more than just the intellectual level, neck up. Remember, a lot of these issues are emotional issues for people, and that neck down stuff is really important in a subject matter like this. I've done everything I said I wouldn't do. I have filibustered, Tim, and I apologize. But thank you for inviting me to come by. I appreciate it very much. Nice to be with you. Yeah.
Thank you, Senator, very much for your work on our task force and also your long history for work in moving things in a bipartisan fashion, which obviously is our first name and we care about a lot here. I was talking with a colleague at a different think tank recently, and they were saying, well, we are nonpartisan, which is in some ways a lot easier than it is to be bipartisan. We're at a place here where we don't, when we have our task forces, we don't ask them to pull down their partisan stripes. We want there to be that fight to sharpen better policy ideas and make the best ideas come out, build consensus for them and support them so that we have long-term effective policies addressing the concerns like the ones we're talking about here today. So I'd like to turn us over to our panel. Our moderator today is Ann Tumlinson. Ann has been working for us for a long time and has deep experience in caregiving, post-acute and long-term care financing and delivery. She is the founder of Daughterhood.org, a project dedicated to improving the information available to caregivers navigating health and elder care systems, and is working to create a nationwide community of caregivers. Ann and the panel, would you please join me on stage?
Thank you. Thank you so much. I was feeling very nostalgic listening to your talk, Senator Dodd, because I was remembering that in very first part of my career, I drafted the floor statement supporting the Family Medical Leave Act for Congressman John Lewis. And I was like 30. No, I'm kidding. I was 24. I was 15. And now I'm in a small business located in Washington, D.C., and I'm paying taxes for paid leave, and I am just delighted to be doing it. I mean, it makes me as an employer feel awesome that my employees have access to 2 months of paid leave. So it's exciting to watch this issue continue to be developed and to evolve. And of course, the Bipartisan Policy Center is taking the lead as usual. So I just want to, Senator Dodd said everything I was going to say, so I'll just say, I just want to say families really want to take care of each other. If there's one thing I've learned in my career, and early on, I thought if we just have long-term care insurance for everybody, that we'll have solved all of our problems with caregiving in this country. And I realize now that that is just a small part of what we have to do. We have to make caregiving work for families because they really do want to take care of each other even when they have plenty of resources to pay for care. And in fact, the evidence suggests that today the vast majority of older adults who need a really high level of care are actually living in the community, and they are being cared for only by unpaid family caregivers. To some extent, that is because of the lack of financing, for sure, and that's a huge issue that we have to address, but also because, like Senator Dodd was saying, they feel strongly that they are the ones who can do the best job, and they want to be there, and they want to be playing that role. But they do pay a really high price for it in terms of financial security and in terms of their emotional health. As Tim mentioned, I am very fortunate to be part of a community that I founded called Daughterhood, and we get a lot of emails and phone calls from people all over the country who are in this situation. And the women in particular that I talk to who are in the sandwich situation, I call it, they often say the same things. I have somebody call me from Michigan and somebody call me from California and from Georgia, and they say the same thing. It's just sort of this they express this intense frustration that there's so many people relying on them for so much. They've got their teenage kids who need help with homework. They've got their parents who need help with bathing and feeding. They have their employers who need their attention. And in the course of a month, I had 2 phone calls with 2 different sandwich generation caregivers who said to me, sometimes I just feel like I want to go back out in the backyard and just scream where nobody can hear me. And I was like, how is it that 2 people said that completely independently from one another? I thought is probably indicative of the kind of stress that they're experiencing. So, I think our policies have to catch up, and the panel here is, everybody on this panel is doing work to help our policies catch up with the reality. My dad and my mom grew up in households where only one parent worked, and the grandparents lived there and contributed financially and to the caregiving of the children. Today, most of my children's peers are in homes where both parents work, and the grandparents are on the receiving end of care more than they are on the giving end of care, which isn't to say that grandparents aren't still contributing an enormous amount in our society, but the much longer lifespans mean that the kind of stress that families are under is changing as well. So we're really lucky to have a panel here today to talk about all of this. And Catherine Hayes, who's the Director of Health Policy at BPC, and Jason Resendez, who is the Director of the Latinos Against Alzheimer's Coalition, which is part of Us Against Alzheimer's. And Tim Shaw is Associate Director of Economic Policy at the Bipartisan Policy Center. And of course, Ben Vecti, who is the Research Director at Caring Across Generations. So we're going to start first with Tim. And just want to ask you, so we're here in large part today because the BPC's been working on the issue of paid family leave, and you've done a survey. So I'd like to give you the opportunity to tell everybody a little bit about the survey and what you've learned.
Absolutely. So we just last week conducted a survey of family caregivers trying to get at this question in particular of the sandwich generation, as I alluded to. So we know across the board, and we have a lot of good evidence on the types of financial stresses that family caregivers face writ large. And our survey largely confirmed those questions. Senator Dodd pointed out that 25% of family caregivers have to pull out retirement savings in order to afford caregiving expenses. Over a third accrue additional credit card debt and go further into debt to afford those those services. And also, they frequently 41% tap into emergency funds. And so we largely confirmed that first bit. But what we were interested in was there's a rising incidence of folks who are both supporting, who are a family caregiver of an older adult as well as a child. And we are trying to see, is the shape of that financial stress different for the sandwich generation in particular? Because that might have a bearing on what type of policies that we want to design for that generation in particular. And in some respects, my generation, 10 million millennials are caregivers. That's about 1 in 4 family caregivers, which is a lot larger than you would necessarily assume when you hear the headlines about millennials. At the same time, 1.2 million millennial mothers are giving birth to their first child every year. We're no longer like these college kids that everyone likes to complain about having avocado toast. We are having kids and entering into family life in a different way than you capture in the headlines. And so we wanted to see the shape of these financial struggles. And we found that the sandwich generation faces these stretches in two particular ways differently than family caregivers as a whole. The first way is that the sandwich generation is much more likely to need to make work changes, whereas about a quarter to a third of caregivers overall choose to work overtime. 50% of the sandwich generation works overtime in order to afford caregiving expenses. They're also much more likely to acquire a job when they didn't have one before, or acquire a second job when they weren't working. This points to the idea that the sandwich generation is more dependent on work than other types of caregivers. The second thing is they're much more likely to create flexibility in their work life. In addition to working overtime, paradoxically, they're also more likely to reduce their work hours. So again, it's this question of how you have to shape your life when you have dual caregiving responsibilities for an older adult as well as a child. I'll stop the summary there, but the upshot of this is I think what that points to is the sandwich generation is would particularly benefit from paid family leave. Paid family leave is the type of policy that allows for that flexibility in the work context, and that those particular types of caregivers in particular are dependent on work and work type changes in order to make caregiving work for them.
Right. So, Jason, I'm going to turn to you next because I just want to build on what Tim is saying about the sandwich generation being particularly well suited for paid family leave, and maybe just interject my own opinion here, which is that the people who are caring for people who have Alzheimer's are maybe even particularly well suited for paid family leave. It's especially challenging caregiving situation to be in, and I know you guys at Us Against Alzheimer's are doing a lot around the issue of paid family leave, so I'd love to hear you talk a little bit about that.
That's right, and I think even the people who are millennials who are caring for individuals living with Alzheimer's and dementia are even more of a perfect fit for paid family leave. But Us Against Alzheimer's is an Alzheimer's advocacy-based organization and social impact organization working to address our shared Alzheimer's challenge, particularly for those communities that are over-impacted and underserved. So I lead the Latinos Against Alzheimer's Coalition, a coalition of about 50 Latino-serving organizations and stakeholders. Some of our partners are in this room. Thanks for being here. And we are really invested in this because we know that this community is really at the crosshairs of this disease. By 2050, nearly 3 million Latino families will be touched by Alzheimer's. 3 million Latinos living with Alzheimer's disease. And that comes at a increased economic impact. We worked with the USC Roy Ball Institute on Aging to calculate that economic impact, and by 2050, we'll spend a cumulative $2.3 trillion in Alzheimer's-related costs in the Latino community alone. That's $2.3 trillion of Latino family wealth wiped out by one disease, Alzheimer's disease. So we see the increase in prevalence rising, we see the economic cost rising, and the byproduct of both those trends is the hardship placed on the backs of family caregivers. There are about 16 million unpaid family caregivers in this country providing Alzheimer's-related care. Tim, you mentioned the 37 billion hours of unpaid care provided by family caregivers. 16 billion hours of that care is provided in Alzheimer's and dementia-related care. 2 million Latino unpaid family caregivers are caring for individuals living with Alzheimer's and dementia. Nearly 50% of those unpaid family caregivers report workforce disruption due to that care that they're providing. That means leaving the workforce, reducing hours, certainly balancing multiple responsibilities to provide that care. And unfortunately, in the Alzheimer's space, as Ann pointed out, it is high intense care. And Senator Dodd, you painted that picture perfectly. 24-hour care, often provided without any kind of formal training. These are medical tasks that these caregivers are providing. These are things that really do require training to provide that care well, and they're just not being, that training is not being provided. And so what we see is really the need to develop these economic support policies and other kinds of policies to support these caregivers, because unfortunately in the Alzheimer's space, of the top 10 leading causes of death in this country, Alzheimer's is the only top 10 leading cause of death that's still on the rise. It's the only one without a treatment or cure or effective means of prevention that we know. And so until we have that breakthrough, we really need to look at ways to support these family caregivers through economic policy and care and support services. And paid family leave is uniquely positioned. And we did a survey and a poll, which I'm sure we'll talk about later on, that really underscores some of those needs and opportunities.
Wow. So when you said that the degree to which the wealth of all of these families will be wiped out, that's a very startling statement, and it's kind of a good lead-in to the work that Ben has been doing, because that's one of the biggest sort of financial risks that we all face, is having our wealth wiped out by Alzheimer's in particular, because the length of what we call the morbidity phase is so long. People do live with Alzheimer's for a very, very long time, needing very high levels of care, and we don't have any kind of insurance to pay for that.
Yeah, and I'll just say one last thing is that in the Latino community.
Right
go ahead.
No, I'm sorry.
All right, go ahead. We've been talking a lot about family caregivers, and there's several things coming together here that make the care risk as a whole. Mm-hmm. So Caring Across Generations, we look at the care risk at a 50,000-foot level of not just being long-term care or paid family leave or child care, but care as a whole. And where you see that come together most is with family caregivers and the challenges that they face. There are three reasons that we've talked about a lot of these so far today, why the care risk has become salient now, and not just in the United States, but across the industrialized world. The first is the decline of the stay-at-home caregiver, which Senator Dodd mentioned in his opening remarks. The second is the aging of the boomers. And the third is that care is getting increasingly expensive. And there are three data points here that highlight those trends. The first is that today's families, because of wage stagnation over the last 4 decades and changes in family structure, today's families need all adults' earnings to make ends meet. Women haven't just entered the labor force because they wanted to have the same kind of career satisfaction that men have had because of sociological changes, but also because families need to have all adults working in order to maintain their living standards. The 64% of mothers bring in at least a quarter of family earnings today, including 41% who bring in half or more of earnings. So this really isn't an option for many families to have someone leave the workforce to provide care. And if they do, it comes at great cost to the family. The second data point is that we're approaching a caregiver shortage. In 2015, there were 7 adults of prime caregiving age between 45 and 64 for every adult 80 or over who is potentially in need of care. And by 2050, that will have declined to 3 of prime caregiving age to 1 older adult. And that trend has already begun, and it's going to create a shortage of both family caregivers and paid caregivers. And finally, care is expensive. Home care aides cost $50,000 a year on average, and daycare costs $10,000 a year on average. So these are very expensive care risks. Universal Family Care is a program that Caring Across Generations, a vision that Caring Across Generations developed, and I'll talk a little bit more about a National Academy of Social Insurance study panel which we commissioned. The idea is to create is that we're already paying for care now. As Senator Dodd mentioned, these costs are hitting families already. They're hitting family caregivers through lost earnings, lost retirement savings, lost Social Security benefits. They're affecting child well-being. They're affecting the ability of families to take care of their parents and let them age with dignity. A social insurance program would pool the risk, all of that risk, and have all of us pay in a little bit out of our paycheck every 2 weeks to pay for this risk gradually over the course of our lives, so that when we have a care crisis, whether it's a long-term care crisis that happens suddenly, or whether it's paying for daycare when a child comes into our lives, that we can draw on those funds, and rather than having to pay $10,000 a year at once, we're paying $50 or $100 a month out of our paycheck over the course of our working careers. Care takes many forms across the life course. Sometimes it's providing care, sometimes it's receiving care. These provide examples of this, but you see that it's a risk that we face across the life course. Policy experts think of care in terms of these silos of paid family medical leave, long-term services and supports, and early child care and education. But families experience these risks in an integrated way, as we see through the experience of the family caregiver. What universal family care would do is better equip. It wouldn't replace family care. As you mentioned, Senator Dodd, there's nothing that could ever replace the care that a family member can give for someone who needs care. What it would do is equip families to better manage the balance of work and care, so that they have access to paid professional care supports, so that they can make decisions based on whatever is optimal for their family situation at a given point in time. Do I want to take time off work? Do I want to hire a professional home care aide? Do I want to do both in various degrees? Maybe my mom needs someone to help for a couple of weeks, a professional aide, and then I can take time off and go down and help her. And that kind of a balance would be available to family caregivers. Sorry, it's hard to read the slides here, so I'm trying to keep track here. There are four sort of main arguments for universal family care, a rationale for a universal approach, which I know is kind of outside the box thinking. One is that the current system of supports that we have are means tested and fragmented. As Senator Dodd mentioned, when you need to get elder care for a parent, it's very bureaucratic and difficult to achieve. Medicaid is different in every state, and the forms are very complicated. Means-tested child care support program is similar, right? But in today's economy, most of the middle class also needs these supports. It's not just poor families who need these supports, but middle class families do as well. That's an argument for a universal social insurance approach. Social insurance also offers a more efficient way to pay for care, and it's a more family-friendly more efficient because you would pay a little bit out of every week rather than when you have a crisis. And it's also more family-friendly because when a care crisis strikes, the last thing you want to be doing is filling out forms and trying to cobble together money, withdraw from your 401k, and deal with all the financial aspects. What you really want to be doing is being present for your family members who need care, and universal family care would make that possible. And finally, it would offer a one-stop shop. Again, Senator Dodd preempted all of my remarks. Right now, if you are in the sandwich generation and you have to take care of a child and a parent, and you're dealing with all of these if you're a low-income family and you're having to fill out Head Start forms and Medicaid forms for your parents, it's a bureaucratic nightmare. And having a simple program that's social insurance, like Social Security or Medicare, those programs aren't as bureaucratic, not nearly as bureaucratic. The idea would be that once you've enrolled in the program, you would have a universal family care membership card, and you could claim benefits in an unbureaucratic fashion over the course of your life. So those are the arguments for a universal social insurance approach. I won't go into details on the policy, but this gives you a sense, I'll pull it up briefly, of 4 different policy options that the National Academy of Social Insurance Study Panel developed. Ann was on that panel, as was Jeff Hayes, who I see with us here today. The panel was chaired by Mark Cohen and Heidi Hartman of IWPR, and 27 other experts in care policy. It developed a set of policy options that states could consider if they wanted to move forward with this, but the options described in this report are also equally applicable to the federal level.
Okay, great, thanks. So one of the many great things about the Bipartisan Policy Center is the degree to which they work on issues in an integrated fashion. So it's really fun to have Catherine here on the panel. Tim's work on economic policy around paid family leave is one piece of a puzzle for families who are providing care for children and older adults who need supports and services, which is Catherine's area of expertise. And you've done so much work in this area, I don't even know what to ask you. Just tell us about everything. But if you wouldn't mind just sharing with everybody kind of some of the stuff that you're working on now and what some of the bipartisan opportunities are.
Sure. We have been very fortunate here at BPC to have a group of leaders, healthcare leaders, who are very much or have been very much committed to long-term care. Those leaders have worked together since 2014. And unfortunately, we just lost one of them over the summer, Dr. Alice Rivlin, who spent her career working very hard to try to come up with a way to provide long-term care in a fiscally responsible way. So the other leaders of that group are former Senate Majority Leaders Tom Daschle and Bill Frist, and former HHS Secretary and Governor Tommy Thompson. And they have worked, as I said, since 2014 to try to come up with bipartisan solutions to sort of chip away at the issue of providing assistance to family caregivers through our healthcare system. One way has been looking at the Medicaid program. What can we do to help states move forward and expand eligibility for home and community-based services so people can remain in the home? And you mentioned my former employer, Senate employer on the Hill, John Chafee, and he worked very hard in that area as a member of the Senate Finance Committee. And beyond Medicaid, they have been working most recently in the Medicare program to think about how one might make minor tweaks in Medicare that could be passed now to improve the availability of social services and supports in Medicare. And some of their recommendations were included in the Bipartisan Budget Act of 2018, one of which was to give Medicare Advantage plans the flexibility to cover non-medical services in Medicare. Next week, we'll be releasing a report that really looks at how one might do that in Medicare fee-for-service. And that's particularly important as we move into a rural health task force project that we're working on, because Medicare Advantage isn't available in so many areas of this country. And if you look at the plans that are being marketed right now, starting in 2020, some plans are covering respite care, some plans are covering medically tailored home-delivered meals. They're covering food. They're covering produce. There are a lot of things that are being done. Now, I don't want to suggest that this is comprehensive long-term care, because it's not. But any little thing we can do to help provide, assistance to family caregivers and relieve that pressure. The last thing that they've worked on is recognizing that we have a private long-term care insurance industry in this country that is failing. We have one major carrier left in the market, and you can only buy policies now that cover very short periods of time, 2 to 3 years. The policies, my in-laws had one of those old Genworth policies that they covered them as long as they lived. And I can tell you, in part, that's why Genworth had to stop selling the policies. Because they really helped out my in-laws. But then there's another issue, that they also looked at and didn't reach a conclusion on, primarily because they recognized we were at a period in time in which we were talking about repealing the Affordable Care Act. But they all expressed a personal interest in looking at what one might do to finance some sort of back-end coverage or catastrophic coverage for those who have exhausted their resources, exhausted their private long-term care insurance, or who are not eligible for Medicare.
Okay. So that's just a little bit. So I just want to go back to both Jason and Tim. You've both done a lot of survey work, which is really helpful, I think, in influencing policy. And I'm interested in your thoughts about when you go out there and you collect information from real people having real experiences, what do you think is the most sort of salient point or survey finding with respect to to pushing forward on paid family leave in the states where it's not currently in place or at the federal level? And let's start with you, Tim.
Sure. So I think when it comes to kind of the data we're collecting on the everyday people's responses and needs for paid family leave, I think establishing that groundwork is really important. The paid family leave at the federal level is going to be something where the devil is in the details of how anything gets passed. That's why it's really important that we're seeing states like Connecticut, Washington, California, Rhode Island pilot what programs could look like, how generous they are, what the wage replacement is like, how many weeks, that sort of thing. I think the most important thing that can come out of this is seeing how people's daily lives interact with any potential policies. To Ben's point, we are already seeing that people already face the cost of caregiving, but that's not to say that if we were to try to shift the costs elsewhere, that there would be no, response to that. We have to take seriously the idea that if we're going to create a federal policy, that's going to have to be paid for somehow. To bring up some of my other talking points from our fiscal policy work, we have $22 trillion of debt, and that's a long-term problem for this country, and that's only going to grow into the future. So as we look towards possible solutions to this, we need to be looking at how much it's going to cost and how we're going to think about how to pay for it. what I think to Senator Dodd's point during his remarks about the groundswell for parental leave, that has come about because we've seen good evidence and good data on the ground about the benefits of it, not just for parents, but also for the economy as a whole. Right, and I think finding that similar evidence that we need to see, not just for caregivers, but also for small businesses, and to really build a consensus around the caregiving side of paid family leave is really important. So we can find that coalition that comes together, like we saw around the Family Medical Leave Act.
Well, I'm just going to interject here, since I own a small business. Again, as from that perspective, that I think as the proportion of people who need care starts to increase relative to people who are available to provide care, that from as an individual business wanting to attract and retain talent, having the ability to pay into a pool in which I am with all the other businesses in my community sharing risk for all of the things that can happen in the day-to-day lives of my workers and my employees is something I find really appealing. Yeah. And I think that the demographics will push, I think, some of these conversations a little bit.
Can I speak to that point really briefly? We also did a survey of small business owners with 50 or fewer employees on their perspectives on paid family leave, and the results were very, very interesting. I think to your point, the vast majority of small business owners in that bracket do see those same benefits of higher retention, ability to recruit, that sort of thing. They also report, unsurprisingly, that when their employees actually take that leave, it's actually pretty hard to deal with, right? Like it's not easy. If you have 20 employees, having one employee take a long period of time is 5% of your workforce. That's a big deal for these smaller employers. And so we have to see, again, there are trade-offs to every decision. They want to provide this leave. That's another thing that we saw. Millennials in particular, small business owners, want to provide leave at higher rates because they're seeing these demographic changes and want to provide it, but they also bear the costs of it and see that very acutely. That's why we have to pay close attention to states like Washington that are piloting grants to small businesses to offset some of the costs they're facing when they provide paid family leave. And again, still be serious about the question of the taxes that can, depending on how you choose to finance it, go along with any national program.
Yeah. So, Jason, I'd be interested to hear a little bit more about the surveys that you've done and what you feel like are the big policy lessons to take away from?
Sure. So for us, we really were curious about, what was the benefit of paid leave for dementia caregivers specifically. So we did a national poll of 600 employed family caregivers of individuals living with Alzheimer's or dementia, oversampling for Latinos and African Americans, given the over-impact of the disease in those communities. And what we found overwhelmingly was that for those folks who had access to and utilized paid family leave, the benefits were tremendous. One, in terms of being able to stick to a care plan, 10 doctor's appointments, et cetera. But then two, in terms of emotional well-being, sort of how those caregivers felt supported and able to provide that higher quality care for their loved ones. And that's of particular importance for millennial family caregivers. We did a survey with leveraging a partnership with AARP. I saw Jean back here at some point. And what we found is of the 10 million millennial caregivers in the U.S., about 15% are caring for someone living with Alzheimer's or dementia. And those folks, if you're black or brown and part of that 15%, you are the most likely to have workforce disruption due to that care, and the least likely to have access to workforce policies like paid family leave, which had tremendous impacts. So what we found looking at sort of that access and utilization was even for those folks who had access, just under half of the folks polled had access to paid family leave. And even for those folks who did have access, just over 50% utilized that leave. And when we looked at that utilization rate, what we found was particularly for Latino family caregivers, lower income African American caregivers, they reported barriers to utilization of that leave. One example I think has been highlighted by Senator Dodd and others is the burdensome application and sort of navigating utilizing those policies, and also a fear of workforce distribution. So there's some really key pain points here that we have to address, even looking at paid family leave as yes, it's going to help family caregivers, but even for those who have access to it, there are barriers that exist that we have to be mindful of as we develop a federal level policy around utilization, around workforce retaliation for the use of those benefits. So that was some key lessons for us that we're looking at as we develop further efforts on the policy.
Yeah. Thank you. And Catherine, I feel like I just keep hearing millennial. What about us Gen Xers? We're always left out. But you thought a lot about all the different generations and the millennials and Gen Xers, and is there anything that how do you think about the differences between those generations and their needs, and anything that we're not talking about?
Well, I think that for the Gen Xers, what they're starting to see are, they have children. I am an example. My son is 25 years old. He has, over the last few years, I am fortunate, let me say, to start off with this, but I'm fortunate to have had my mother living with me for the last 17 years. And my husband and I were both staffers on the Hill, and we could not have worked in the Senate without her being there and taking care of my son and picking him up every day. But as of January of this year, she fell and broke her femur. And my husband and I are both former health staffers. We both practiced health law, and my husband is a pharmacist. And the two of us trying to navigate the process was just unbelievable. We even had my husband's sister is a former cardiac care ICU nurse, and her husband is a nurse practitioner. And so many times we had them on the phone, sort of questioning, they're going to give her what drug? No, she can't take that. And it's just unbelievable. So, I think those of us who are in this age bracket right now trying to pay for, and, the sad part about this is my mother was in and out of skilled nursing in the hospital for 3 months, and we had 24 hours notice that she was going to be coming home. And we had to really scramble. And fortunately, well, I don't know that we really had the resources to do this, but it cost us about $10,000 for private duty nursing. That was our retirement. At the same time, we're trying to pay off our son's college loans. And so that's sort of where I think the Gen Xers are coming from at this point. But fortunately, after 4 months, she did qualify for Medicaid. So we do have 8 hours of care now.
Good. Well, I have to apologize because that is actually my phone that you all have. And I really thought I had turned it off, honestly. So I must have had it off and turned it back on by accident. So Catherine, that story it made me think of, the other kind of email that I get from Daughterhood readers all of the time, which is sort of like, mom's coming home from the SNF. What am I going to do? Because she still needs care, right? But I have to go to work. I mean, that's kind of the essence of the way that this problem often kind of arises and presents itself in people's lives. And you're not the only one. I mean, we all have our stories, right? And I know Ben has been very involved in his mother's care. She had Parkinson's disease, which is another one that can go on for a really long time. And you probably missed a lot of work. And took advantage of the opportunity to take care of her. You want to just share a little bit about that, and then we'll open it up for some questions.
Sure. Well, I mean, I experience this, and many of us have. It's not just the financial aspect, although that is, of course, the first thing people. I mean, it's the most tangible thing, the financial demands of it. But time is one of the scarcest resources you have, right? Time to be able to spend with a person, to go down there and do what you need to do. To redo the bathroom, or get her husband to accept the idea of a home care aide sitting on the couch for 6 hours a day. And all of the transitions that you have to stay as long as possible in the least restrictive environment, and you have to gauge that risk-reward ratio constantly, because that's a constant challenge. And being remote of course is difficult. We often would say with friends that my friend his dad's in D.C. and he's like, why don't you take care of my dad and I'll take care of your mom in Florida. We that's what millennials would do, right?
That, by the way.
Right? So no, that's a challenge. There's so many challenges, but I think the scarcity of time is one of the biggest ones, which is why paid leave is so important.
Right, great. So we have just a little bit of time now for questions, and I want to just open it up for anybody who wants to ask a question or even just share an experience that you have in a situation like this. Yeah.
Sure am.
Yay.
Hi, Lisa Winstall with Caregiver Action Network, and thank you all for your comments and your efforts. And I think we were just about to get into some of the more interesting things, because while support financially is really important, time is important, leave is important, none of that is even applicable when you get that phone call, oh yeah, we're gonna go ahead and release Dad from the hospital today. And at that moment, you have to deal with the fact that you're at work, somebody's got to pick up your kid from school, and you've got to then take Dad home from the hospital, usually on a Friday afternoon. And they can't even get somebody to the house to do an assessment for the home care that is prescribed until Tuesday, because they need 24 hours after they get the order, which will then be on Monday. And by that point, you're missing 3 days of work before you can even think about accessing leave. So that's one of the realities, and there are lots of studies, I don't have to tell everybody in this room, the discharges are happening on Fridays, and this is a real problem. And the other part of that, and Jason, thank you for bringing this up, is the retaliation. And I'm speaking as somebody who, not when I was working for Caregiver Action Network, but for someplace else, got that phone call. My mom just needed my help to go to the hospital because she just couldn't do it anymore. My dad was not dying. He had had a knee replacement and it wasn't going well. So she said, can you please come? And I said, sure. Because I had a job where I had plenty of leave. I had plenty of paid sick time, vacation. I even had, comp time I could use. So I said, no problem. I'm on my way. I stood up to leave and was told promptly by my work to sit down because my dad wasn't dying. I could very well go after work. Okay? About a month later, I was fired. We need to address that kind of situation as much as we need to address everything else that we're talking about.
Yeah.
So.
Thank you. No, that's great. Thank you. Any other comments or questions? I'll just say I heard, I think it was NPR this morning, there was a report about people not taking even their vacation time.
Yes.
So we all have paid leave, but not even taking paid vacation time because of fears of retaliation. So there's certainly a lot, I think, to discuss with respect to work culture in this country, and how it relates to how we're going to take care of all the people we have to take care of at the same time. So, oh, great. We have another question right here.
Hi there, Drew Brazier with Blue Star Families. And Tim, I think this question would be directed towards you. Did your survey identify any particular demographic trends in terms of like the caregiving responsibilities of military spouses who have to take care of, injured veterans or active duty service members?
Unfortunately, our sample wasn't big enough to dig down to that particular demographic.
Thank you.
All right. That was a good question. Any others? Okay, we have one over here. Oh, here's Ann. Okay.
Thank you. This is part of sharing my experience, and I didn't hear it discussed here, but I think it's part of how do you support the family caregivers, especially the people that are in charge. And you talked about the discharge from the hospital, surprise, surprise, and not having any clue what to do next. But then the other aspect that I saw when I was being sandwiched, I'm now part of the bread. So when I had an aunt and uncle who did not have children, and they lived in the Portland, Oregon area, and I was getting phone calls and having to, unfortunately, I was in a situation where I could stand down from my work and fly out there to help. But I'm there, and I'm observing what's going on in the home. And my aunt is running the show, but she finally brought in people to help, because she was going to probably kill herself, and what was going to happen to my uncle if she died. So I'm watching this, and I'm seeing a personnel management challenge. Fortunately, she was a professional woman who had had people working for her and knew how to manage a workforce. But a lot of us don't have that experience. And I would think the one thing that I've heard missing here is talking about training or preparing people to be caregivers or supervising their parents or aunts and uncles' care.
Yeah, absolutely. You know, I always say being a caregiver is a little bit like being the CEO of a company. You're drawing on a lot of the same skills, being able to delegate, ask for help, identify needs, prioritize resources, lots of things like that. But Ben,
Yeah, so a couple things there. One is that when we were doing interviews with sandwich generation caregivers, we did dozens of interviews, and that came up over and over again. And the suggestion from the family caregivers that we interviewed was often to have like some kind of a counseling 1-800 number, toll-free number, or some other, maybe have a system if you had a universal family care program where caregivers could advise caregivers, where you could have some kind of network where people could talk to one another and because people are isolated. And one other aspect of that, which I neglected to mention before, is the workforce challenge here, which is that we have a shortage not just of family caregivers going forward, but also of professional caregivers. And that ties in with immigration policy, obviously. And if you don't have a strong immigration flow, you're not going to have a strong care workforce. And the care workforce is significantly underpaid right now with low benefits as well. The average wage of a direct home care worker is $15,000 a year. And as a result, there's heavy turnover. Many people leave this field to go work in fast food or retail, which is remarkable. And so if we want to have high-skilled, or at least skilled, dependable workforce providing these services to our parents and to ourselves when we age, or to our children in preschool, we're going to need to think of a workforce strategy that pays these workers adequately, has workforce and training, has training ladders, et cetera, to make this a desirable career. Yeah.
Yeah, I want to follow up on that because I had exactly that set of questions. Susan and I are both members of village movements in Capitol Hill, D.C., and we're involved with advocacy efforts around home care workers and have been researching the looming shortage of home care workers, all the problems that you mentioned. But as I've listened to you talk about family home caregivers, it feels to me like there's potential for collaboration and thinking of this as the same workforce and trying to think through strategies for providing both training, social supports. We're interested in co-op movements, for example, as a worker strategy. But somewhere we have to think about bridging the qualifications divide between family members who are doing it out of the goodness of their heart and the love for their family, but need the training support and the economic support of being a worker while they're doing this labor in alliance with the certified home care aides we're concerned about as well. And that's a new thought for me. I don't know where to go with that.
I would agree.
Oh, I'm going to ask Lisa to talk about that. Yeah.
So, just about a month ago, HHS through the ACL did put out a request for proposals. There's going to be one grant awardee announced at the beginning of August, and this is going to be running model programs across the country to test the solutions that you were just discussing. So it's going to be different ways to provide community support for family caregivers and also for their care recipients. But the focus is on programs that would support the family caregivers. So the structure of the grant, no matter who receives it, the structure will be that you'll be giving sub-awards competitively to different communities to test different models. Sort of building in a way on some of the village models, but actually going farther, much more beyond that. So we're looking at models that would work in rural communities, models that work in urban, and different ethnic and cultural issues as well. So like I said, whoever wins that award will be doing this work. It is a 5-year program. Only 1 year of it is currently funded. So if you would like to put on your advocacy hats when it's time to get funding for subsequent years, that's something probably everyone can get behind. The thinking behind it is that at some point then we'll have a model that works in communities to support the family caregivers in multiple ways that we can then deploy.
Thank you.
And I just, if I could add to that, sort of the importance of upskilling family caregivers, and that the bridge that can be made with upskilling also paid caregivers, particularly around highly skilled care required for diseases like Alzheimer's. We know that that is one of the primary drivers of unpaid care and paid care in this country is around chronic disease like Alzheimer's disease. Yet we're not investing enough in developing standards of care outside of institutions for Alzheimer's and dementia. So we as an organization have been advocating, along with partners as well, around pushing HHS and NIA and through NIH to develop and invest in the same way that we're investing in biomedical research, to invest in the research into standards of care and care practice for Alzheimer's and dementia, so that when we are upskilling caregivers, that we're doing it in an evidence-based way and that we're doing it in a way that is validated across cultures, which is really important to us and just to the reality of the demographic shift that's happening in our aging society.
Yeah, great. Okay, we have time for like one more if anybody has one. If not, that's okay.
These always end up kind of a little bit of a downer sometimes, because we don't have the solutions and, we don't see what's going on right away. But I would like to just ask, I was on another panel once and they just said, can you tell as a family caregiver a funny story about caregiving?
Oh, I bet you have some.
Oh, yes. My favorite was getting a call. Actually, my sister-in-law got this call from her mother who could not see. She was legally blind. And her father, who could see very well but had dementia. And they called, and the way they are getting around it, they're driving, and Betty can't see, and Paul doesn't know where they're going, and they call, but this has worked for them for 5 years. And so my sister-in-law, Becky, got a call saying, we're lost. Where are we? And this was before the GPS phones. But just the way the two of them, who were married for 70 years, I don't know how many years, but the two of them worked together and made it work for so long.
Yeah.
They're just great stories like that.
I think that really points to the idea that there's a resiliency.
Right.
Senator Dodd talked about sort of the joy that he feels in providing care, and there really is a resilience that emerges from these situations that we need to better tap into and to cultivate through things like paid family leave and through things like universal care. The last thing we want to do is extinguish that resiliency through the growing hardship that we all face.
Yeah, really what we're trying to do is use social change, public policy, cultural change, really to shore up and strengthen communities and families. That they form the basis of our social connections in American life, and the solution set to strengthen them is multidimensional. I feel like that's kind of the lesson that I'm taking away from, as I'm realizing I'm wrangling this panel that's really about quite a few issues at the same time. But it's workforce culture, it's community culture, it's paid family leave, so we have to have the financing in place for long-term services and supports. We have to have healthcare delivery systems that work better than they do now. And we have hubs of information at the community level, at the villages and AAAs and other places where people can go and get the support, information, and training that they need. And I think it's a holistic set of, it's not just one solution or one idea, but if we can put all of these things together, we can move, we're going to have to create a caring society because we're going to have a lot of people who need care. So at the end of the day, I think it can make us, now I'm really on a high note. I think this is an opportunity to rise to the challenge, and I have a lot of confidence and I'm optimistic about that. So thank you all for hanging in there and being part of this and asking such good questions, and really appreciate it.
Thank you.